All right, good morning. Thank you again to everyone who's on this call. I'm happy to see everyone on here. Chief Bruner is out today and asked me to just kind of lead this call, and then we'll have questions at the end afterwards. And one big change is that we are returning to doing these public EOC briefings once a week. There's just enough new information coming out that it's worth a weekly update, and then these recordings get uploaded to YouTube, and then those get posted onto the stick.org website, which is shared on social media, both Stick and the Makah Tribe's social media. So we just want to make sure we're getting info out on a regular basis, especially as cases are continuing and things are changing during this pandemic. So let me connect to the slides there. So on Friday, we had 2 new cases of COVID. It was a couple that lives together and were traveling, and so that is just one household that is COVID. Those tests, it's been confirmed by the send-out tests, so both rapid and send-out tests have been positive. Only one other household was exposed, and that household is also in official quarantine at this time. We did look at a number of people, or test a number of people who were not technically exposed, but potentially could have, were within the vicinity of the active case. And I do want to take a second to remind folks that an exposure is an exposure to someone who has been diagnosed with COVID. So when we're doing our case and contact tracing, we contact the people who've been exposed to the person who tests positive for COVID. We don't go beyond that and contact people who've been in contact with the person who was in contact, if that makes sense. So I just want to remind folks, we got a couple of phone calls on Friday, and just had to explain a little bit about why we call who we call. But we do go a little bit beyond what the technical definition of a close contact is, and that's just to be extra safe, which has helped us in our COVID response throughout this pandemic. So we have 2 households in official quarantine. We do have the Health Order 0421 in effect, which has us in phase 4, which means that all gatherings are allowed, and indoor gatherings up to 200 people. There's a set of recommendations that are in effect at all times, which include wearing masks and just being careful and cautious about who you're socializing with, and knowing what kind of risks they have been taking as well. And I just wanted to highlight that the Makah COVID-19 public health protocols are on the stick.org website if you wanted to take a look at it. But even though we're saying that it's okay to, the Makah Tribal Council has approved having gatherings, etc., there's still a lot of things that individuals can do. So I just wanted to highlight that as well. Masks are not required for fully vaccinated individuals, except in healthcare settings and in transportation settings. And some personal visitors are allowed, and all of those requirements are spelled out on the website. Clallam County is still high risk. They're at 4.6% positive. They have 99 active cases, which is, I believe, the highest active caseload I've seen. Some of their cases, or a slightly increasing percentage, are vaccinated individuals. And they have 3 current hospitalizations and no new recent fatalities. They had 2, I believe, early last week, but more recent than that. This is just a graph showing that it's a few days behind the data I just showed, but as you can see, there's definitely an increase in cases happening in Clallam County. And same with Washington State. Let's see there on the far right. And then same for the United States as a whole. So the rate of increase has slowed down just a little bit. At the end of last week, it was closer to 200% in terms of the rate of increase. Here, I'll show those numbers. Now it's down to about 144%, but as you can see, hospitalizations are way up. So that's certainly what we're concerned about from the health officer perspectives. Here's some information on the variants of concern. So Alpha is the B117, the UK variant that we were monitoring a lot earlier this year. There's a number of cases in Column County and have been for quite some time. The Delta variant, this is the third column down here. That's news today, is that Column County has 15 cases confirmed. And certainly something that we were aware of and truly believed before that was confirmed. And I've got another slide at the end where I want to talk a little bit about just about these tests and what they truly represent. And then these are the variants of interest. So not as concerning as the first four that were on the previous slide. So here's some charts that the Department of Health does to help us look at what percentage of tests that are done are any of the variants. So this light blue one up here, this is the Alpha B117. And as you can see, back in March and April, that's when we were starting to see that like quickly overtake any of the other variants. But also the total number of testing of those test samples is much higher than anywhere else on this time. So you can see the total number of COVID tests that were sent for testing what kind of variant they are is up here. And when they were doing a lot more testing, a lot more tests were this B117 Alpha. So that's probably the most accurate time period or timestamp of what the variant activity has looked like. These times down here at the beginning and at the end are going to be a little less accurate because they are representing a smaller sample of the total number of COVID tests that are being done. As you can see, the orange one is the Delta variant, which has been present in Washington state since end of March, and then has steadily grown to be a larger percentage of the tests that come back are this Delta variant. So this is all just to illustrate that actually there's probably way more cases of variants than we even know from the numbers that are getting reported. And this chart looks at vaccine breakthrough cases. So these are individuals who had the vaccine and they are a full 2 weeks after the final dose of their vaccine, and which percentage of those cases came back as being positive for one of the variants. So of our vaccine breakthrough cases, the highest percentage of those who had a variant, most of them were the Alpha, which is interesting given the percentage that the Alpha represents now, which is less than the Delta. Anyways, and then the Delta one is 14%. So we are seeing vaccine breakthrough cases with these variants for sure. Right now they are mostly the Alpha. And then this is the slide I was talking about, that not all of the tests that come back positive are sent for further testing, and it isn't a random sample. We, the Department of Health, and then us here as well, like we strategically think about why would we want to test this for a variant. Here our caseload is so low that we would naturally request that nearly all of our positive cases, especially if the person is vaccinated, would get tested. So, and this is just an excerpt straight from that report. So I want to be really clear that when we're saying this number or this percentage of the variants, that there's actually a much larger amount of those cases out there. And that is just a reason to be more cautious. All right, so total number of vaccinated community members or residents in Neah Bay. This first 2 lines is actually not just community members, it's who STIC has vaccinated. So STIC has done a number of vaccines for people who live off the reservation, either employees or enrolled Makahs who've come home to get the vaccine. And then down here, we've got our Neah Bay residents with at least 1 dose is 933. And then those with 2 doses is 876. We were previously reporting on percentages and we're still working on that. But it is very hard to get a percentage without knowing the exact number of people in these age categories or in this residential category. But we do know those numbers and are just reporting out on those. So as a reminder, we have all 3 vaccines available, Moderna, Pfizer, and Johnson & Johnson. If you have any questions about getting the vaccine, you're still unsure or you have family members, please don't hesitate to talk to them. Don't hesitate to give them my phone number, which is 645-2224, or have them connect with their primary care provider here at the clinic. We're happy to answer any questions that they might have. And that is it for this briefing. So I'll go ahead and pause if anybody has any questions, either in the chat or want to. Sure. All right. Patty, did you have any updates for the tribe side?
Just a couple of reminders. The small business applications, those are due by Friday, July 30th. And also the financial assistance that was given to tribal members. There's a deadline on that if they haven't received it already, to apply by September 30th.
All
That's
right.
it.
Great. Thank you. Any other questions before we end? All right. So Denise put a question in the chat about the one of our employees who's no longer working for the tribe. I don't know if you see that, Patty.
I do. It's the position is advertised. I don't know, it may be done being advertised actually, but it was on the portal.
Okay. Great. Thank you. All right. Well, thank you again, everyone, for being here. This meeting will be downloaded to our YouTube account and posted on social media and on the website. So thank you, everyone, and I hope you have a good week. Please stay safe.
Bye.